Thank you for joining me this afternoon. There's a number of items that I want to cover today. Let me start by mentioning redistricting. If we'll bring the map up, we've heard from a number of people once we released the maps last week that they wanted more level of detail on our redistricting website. I wanted to announce today that that level of detail at street level is available on the interactive map at My Districting Arkansas, and you can see here the House map, and then you go to the next one, you can see the Senate map, and you can have it broken down. You can have it looked at the street level, and so we again invite everyone to make their comments on this. We've had a lot of positive comments. We've had some constructive comments of things that they would like us to look at that ought to be double checked, or some different corrections. And so it's a very serious public comment period, and we invite everybody to go on the website and make their public comments. And you can, at arkansasredistricting.org is that website. Secondly, I wanted to talk about the trip that I just took over to Earl, and I wanted to give regards to the Earl Bulldogs that they gave me this mask today. And as I was in Earl, and of course celebrated with Parkin, a broadband initiative in which there was a $3.7 million broadband grant that was given by the Rural Connect grant program. This is a partnership between the City of Earl, the City of Parkin, and Comcast, and it will result in 2,300 additional homes and businesses in that area when completed having access to high-speed broadband internet. And to date, the Rural Connect grant program has given out $280 million in funds and in grants that covers 213,000 Arkansans now have access to high-speed internet as a result of this grant program. We're continuing to push these out, but I wanted to be in Earl and Parkin today to celebrate and applaud Comcast for giving, not only participating in the grant and the development of the high-speed internet, but also giving out 500 laptops to every person in the Earl School District. So I was very proud of that. Secondly, I want to mention our revenue report today, that in the revenue report we're $15.8 million above the revised forecast, and that's a singular point of exclamation, but also success, because we moved the forecast up to project additional revenue based upon what we had been experiencing and what we see as the economic trends, and to be above that revised forecast is good news for our state and reflects the strength of our economic recovery that we see. And then fourth, actually, I wanted to mention that I will be making an economic development trip to Israel that will begin this Saturday and extend into next week. This is my first economic international trip since the pandemic hit, and the focus of this trip will be speaking at the Prime Minister's International Smart Mobility Conference, and the fact that I've been invited to speak reflects Arkansas's leadership in advanced mobility and smart mobility. In 2019, we passed legislation that allowed a pilot program for autonomous vehicles that has been engaged in that pilot, but we'll be speaking at the opportunities in smart mobility. They're expected to be 5,000 people from 40 different countries, and so it's a great marketing opportunity for the state of Arkansas. And also, I'll be focused on the aero defense industry, which we have a good partnership with Israel, and aero defense is one of our leading exports in terms of manufacturing. So I wanted you to be aware of that, and for that reason, our daily update will be delayed next week until I get back. And then in anticipation actually of an announcement from the CDC, I wanted to advise everyone that Arkansas is well prepared to get out the vaccines and make them available for the new age group that we anticipate being approved, which is the age group of age 5 through 11. Now, those, they've had periodic news announcements. The FDA approved it, but then it's got to go to CDC, and we expect their decision on this today, which I expect to be positive. But it has not been permitted to give the vaccines out until the CDC actually does its approval today, when they act upon it. But we are prepared to get that out, and we wanted to cover a couple slides on this. First of all, how do you get your child vaccinated? First of all, wait till the final notice from the CDC. But as soon as that happens, then you can call your local health unit, and most of our local health units already have the vaccine that's needed for the age group 5 to 11. And that is a different vial than is used for adults. It's a different quantity of the vaccine for ages 5 to 11. There is at least one in every county, so that's one that you can check with. And then there's a vaccine for children's providers, which is where you normally get your flu vaccine for the children or your smallpox vaccination. These are routine providers for children, and so they will have them available as well probably by the end of this week. The Department of Health has the vaccines, but as soon as it's approved by the CDC, we'll break that out to make sure that the local physicians and other providers will have those. If the parents are unsure, if the provider is administering the vaccines, they can contact them, they can call the Department of Health toll-free number, and they can get a local provider that will have it. And then soon after we do the initial rollout, other pharmacies and clinics that are routinely doing vaccinations will get a supply available to them, but it'll be a rolling steps in order to get that to everyone. And then if you look at the next one, it just really emphasizes the need for vaccinations and the increased risk among children as compared to last year. So children in Arkansas saw a 50% increase in cases and an 84% increase in hospitalization due to the Delta strain of COVID-19 between the winter and summer peaks. Now, these are small numbers, but it shows the increased risk of the Delta variant and what we've experienced. And we have seen an increase in cases among that age group, and so for those reasons, we want parents to seriously consider the vaccination of the ages 5 to 11. Let me emphasize a particular point. There is no mandate in Arkansas for vaccination of children or anyone in terms of COVID-19. In terms of state government, state policy, obviously the private sector has the rules that they want to set in their workplace, but our schools do not have a mandate. Our state government does not have a mandate. There is no intention to impose those mandates under state rules or in our Department of Education. That's something that I spoke with Dr. Romero about. We're together on that. Of course, that is the policy of Arkansas, and we want to assure everyone this is something that is a parental decision for their children. We encourage it. We encourage that discussion and to get the right information, to talk to your physician, but there is no mandate on that particular age group. And there's the call center number if you want to call the health department to get a specific location that you can have your child vaccinated. With that, we'll go to our case report, which will be brief, but our 641 new cases last 24 hours is up from last week. I think it was about 500 last week. Active cases up a little bit, even though they're down for the week. Deaths, the 28 catches my attention. I'm sure it catches your attention. Many of them were carried over from the previous 24 hours, so that's really reflecting about 36 deaths over 2 days, which is still too high, but it's been a fairly consistent pattern, regretfully. And the vaccinations, the doses given are 10,327. Of those, 21% are first doses. I'm actually pleased with that in the sense that there is some expectation the first doses will go down, but they've been maintaining steady, and so we continue to make progress in our first doses, which is a test as to whether we're going to increase those that are partially and fully immunized. We're, for the first time, obviously, over 1.4 million Arkansans that are fully immunized here in the state of Arkansas, and we increased it almost 2,000 just in the last 24 hours. Hospitalizations down 6, ventilators down 1. Next, I want to just point out a couple of things before I turn it over to Dr. Romero. This is the percent of adolescents ages 12 to 18 who have been immunized. And I'm pretty pleased with the progress in this area. One, it takes parental consent. It shows the study that parents have given to this age group and the decisions they've made to get the vaccine. So we have over 50% of that age group has been partially or fully immunized, over 50%. And that is a pretty good trend line up. We hope that it will continue there. Next, you'll see the adolescents 12 to 18 that have immunized by week. And I've asked the health department last week to give us a trend line for 12 to 18 so that when we start doing the 5 to 11, we can compare that and see what we should expect. And here you see the when the visor was available for the 12 to 15-year-old, you see how that increased dramatically. That's that second big jump, going from about 3,000 a week to 8,000 a week. And that, I hope, will be the initial jump with our ages 5 to 11. And then you can see how it tapered off. But then you've also seen that increase when school started, was that big jump there in July and August. Because obviously going back with extracurricular activities, a lot of incentives to get immunized. So that's instructive on the pattern. And with that, Dr. Romero, I took a little while here, but I invite you to make your comments.
Thank you, Governor. First of all, the system for delivering vaccine, the new COVID vaccine for children, is in place. It has been designed in order to give parents access to the vaccine, initially through the local health units and eventually through private practitioners, pharmacies, and clinics that are deliverers of vaccine. The initial focus will be on the vaccines for children providers. Starting next week, any provider that has signed up to administer vaccine but is not a vaccine for children's provider can get access to the vaccine. As the governor explained, we're receiving large shipments of the vaccine in 300 vial aliquots. These need to be broken down in the local health units and then distributed outward. And next week, towards the end of this week, we'll receive smaller allotments of 100, which can go directly to the clinics if they so desire. I also want to point out that the vaccine for this age group, 5 to 11, has been shown to be safe and efficacious. And as I've said before, for vaccine for all previous age groups, this is going to be followed well into the future, so that if we see signals that are of concern, they will be examined and closely evaluated to see if there is a need to continue the vaccination or modify it. So this vaccine will be followed well into the future. These children should be considered for vaccination. This 5 to 11-year-old group, as was shown in the slide, they bore a big part of the brunt of number of cases that we saw in this summer surge due to Delta. So we need to protect them. This is a way to do so. and it is advisable. I strongly recommend this for children in this age group. Of course, it is a decision made by the parents. As the governor stated, we do not have a mandate for immunizing these children at this time, and we'll wait to see if this is even a consideration into the future. But at this time, this is not a mandate within the state. It's an individual decision of parents to make. So I'll end here and turn it back over to the governor. Thank you, sir.
With that, we'll take any questions.
If the CDC recommends the vaccine for the 5 to 11 age group today, for instance, like later tonight, how soon would kids be able to get the vaccine from the local health units?
Well, it would be immediately available. And so it would just be a matter as soon as they could make an appointment. So if it's approved at 3 o'clock or 4 o'clock today, and you can get with our Department of Health, conceivably you could have an appointment today for that purpose, or you can set up the appointment for tomorrow. And so it'll be immediately available. It will be more limited initially because we're waiting for approval. We'll get more into the Department of Health and out. So there will be a little bit of a slow rollout, but they will be available through our Department of Health immediately upon CDC approval.
Do you think we'll have enough supply for the initial demand?
Dr. Romero, I'm going to let you address that more specifically.
So thanks for that question, Andy. Yes, so to let the public know, we will receive nearly 110,000 doses in the initial wave. So there is more than enough vaccine available for children here in the first wave of vaccination. It's also important to note that it's best if you call ahead to make an appointment. So they will see walk-ins, but they'll have to wait a longer period of time. Also, it's important for parents to call your personal physicians of the children to make sure they're administering the vaccine, because some may not. So check with them first, and if you have any questions, you can call our 1-800 number. Thank you.
Anyone else?
In the first rollout for kids, we saw a lot of schools holding clinics. I know it's pretty early on, but do we have any idea if schools will be providing that easy access for kids and parents as well?
I expect that they will. That's their individual choice, but we want the Department of Health will support them in hosting a clinic, and we expect that to happen, and we encourage that to happen. We want to do everything we can to make it as available as possible for the schools and for the students.
And follow up in terms of distribution, this vaccine for the Pfizer for young kids doesn't have to be refrigerated like the adult one. Do you think this will also help in those rural areas as well, getting more of those kids vaccinated for easy access?
It's very easy to store. There should not be any problem there. It's in every rural area of the state through our local health unit, as well as will be available through various providers. So yes, it should be easily accessible just like it was in the 12 to 18-year-old.
The cases seem like they're not declining as steeply as they used to be. Kind of hit a little bit of a plateau maybe here. What do you think is behind that, and are you concerned about that?
And I'll comment, and Dr. Romero can comment, but we've had a steady decline week after week after week. And so it has been a consistent decline. This is the first uptick, but you have to just simply wait and see what tomorrow looks like, and to see whether we're flattening out at this level or whether it's going to be a further decline. We just don't know. Dr. Romero, you want to add to that?
So, Andy, you're correct. I mean, what we're not seeing as rapid a decline as we had seen with the winter surge. And the reason why is because COVID is much more transmissible, right? So we are seeing the decline, as the governor said. It's slower. It has to do with the number, with the transmissibility of this disease. We're watching it. We noticed that slight uptick. We can't say that this is a trend. It's a single day. We're going to watch it very carefully, but we'll give you more information as we go forward.
sorry to beat a dead horse, the timing of the special session on income taxes, was that just delayed for the Board of Apportionment to allow more time to allow the Supreme Court to rule on the Texas abortion law, or to reach agreement on what other issues will come up in the special session?
Well, first of all, you can beat that horse any week you want to. But in terms of the special session, really we've reached an agreement on the framework of the tax bill, an agreement with the leadership. And so we have to put that in bill form, and then we have to get a majority of the members to say, yes, I will support that if you call us down here in special session. I want to make sure that the main item of the agenda has broad support before I bring them in. So I'm waiting on that. And then secondly, you want lead time, and you've got Thanksgiving coming up. So those are some time frames. So I've got to first get that commitment from the legislators that we have sufficient votes to support that tax cut plan. And then we'd probably be looking at sometime after Thanksgiving, but that date has not been set, and it won't be set until I get affirmation that we have the votes for it.
Not asked about, you have a waiver request for Medicaid expansion. Any update on where you are or when you expect a decision from the federal government?
We've been assured that they will act on that in sufficient time so the waiver doesn't expire, which is the end of the year. So our DHS is working diligently with them on that. I don't anticipate any issue in getting the new waiver granted, but it is that specific time frame is undetermined.
I guess the one issue that seems to have dominated some press coverage is the fact that Representative Godfrey was outside the majority Hispanic district. Where did that idea emanate? Was it your staff, Secretary of State staff, AG staff?
Yeah, I'm not sure that was anybody's intent. That's an example of where you look to create a community of influence, which would be in that case a majority-minority district, the first Latino district. And Representative Godfrey's new district has significant Hispanic population in there as well, but it's not a majority district. I've talked to Representative Godfrey about that. It was not my intent to leave her out of that. We just simply draw the lines to create that, and that was one of the outcomes. We'll take a second look at it. Part of it will depend upon the community and the public comments that are made, and whether adjustments can be made that does not influence 5 other districts around. And so that's a big factor in whether there can be any changes to it at this point. Is there anybody remotely has a question?
Yes, good afternoon, Governor. Brett Rains, 4029 News. Do we have an idea approximately how many 5 to 11-year-olds are in the state of Arkansas, roughly? And then I'm also curious about if we have an update on our Test to Stay pilot program that's been in place in a few schools for, a couple weeks now, I believe?
The Test to Stay program has rolled out, I believe it's 50 schools that have signed up for the Test to Stay, which is a great pilot, a lot of enthusiasm for it with the adjustments that have been made. And so that's ongoing. And in the second part of the question, as to the number of 5 to 11, I'm going to ask Dr. Romero to comment.
Thank you. Yes, we have 271,000 and change children between the ages of 5 and 11. And yes, the Test to Stay has been rolled out. More schools are rolling it out. They didn't all roll out, start from the starting gate at the same time. So there are more coming on. And there are a little bit over 50 schools that have signed up for Test to Stay.
I asked Dr. Pfeffer if there's any report from education. She says, no, everything looks good. And so that's good news for us as well. Any other questions?
Hey, Governor, this is Michael Wilson with 5 News of Northwest Arkansas. I have 2 questions, one about kids and vaccines. I know that you had a goal for adults with vaccines. Do you have a goal of how many kids you want to get vaccinated by a certain time period or such?
There is not a specific goal for that. I may down the road, reset some specific goals. Whenever you're looking at the 5 to 11 with the parental consent required and the decisions they have to make, I don't expect to have a goal set for that age group. I do believe that you compare it to where we were with the 12 to 18-year-old. I think that's something you compare it to, and whether we're going to reach the 50% as we have with the 15 to 18-year-old, that will be 12 to 18-year-old, that will be a very interesting test of acceptance by parents and trust in the vaccine. So let's see how that develops. We want to encourage it, but I don't have a specific goal right now to pass along to you. I would love, as a state, that we catch up with the national average. We want to continue to improve our statewide vaccination of adults and the other age categories because we want to make sure that we have a good winter. Anything else?
Thank you. And then I did have another question, separate, about the at-home COVID test. So I want to ask, do you think that more people are switching to these testing sites? And if so, do you have any concerns about people not reporting positive test results? And if you think we'll have enough, during the holiday time, enough of these kits?
I know that a significant number of people are using the rapid tests that they can acquire at their local pharmacy, and we don't have a good reporting mechanism on there. And so whenever you look at our PCR and antigen tests that we have reported to us, that is likely to be a small measure of the amount of testing that is going on in the state. And that's, it's a good thing. You're going to see that trend continue as tests become more available and less expensive. People get accustomed to it. I think that's just the pattern for the future. But we will be able to measure, though, if somebody has a positive on that or they get ill, they go to the hospital, those are firm measurements. And so regardless of the testing level, you can measure those and we'll be able to continue to judge that in the future. Dr. Merrill, did you have anything else on that? All right, with that, thank you very much for your attention today, and we'll see you soon. Thank you.